Look, thank you very much for coming, everyone. Just to update in relation to our current situation on COVID-19, I can confirm that there are 5 new cases of COVID-19 in Western Australia, 3 males and 2 females between the ages of in their 30s through to their 60s. I can confirm that they are all returning travellers, having returned to Western Australia from the UK, Europe, US and Japan. So obviously now the contact tracing teams will get on to working with those people to understand their movements, their flight details and so on. And those flight details, in accordance with usual protocols, will be placed on the Health Department website. In addition to that, you would have seen the comments from the Prime Minister since we last met. The Prime Minister has called for a national cabinet of all state chief ministers and premiers around making sure that we can address the issue of COVID-19 together as a nation. That means that the Premier will be working with the Prime Minister and other premiers to make sure that together we can put in place national protocols, national approaches, and ensure that as a nation we get through this together. You would have heard also the announcement from the Prime Minister this morning of raising international travel to a level 3 advisory. That is, no international travel unless it is absolutely necessary. In addition to that, we've also accepted the advice from the AHPPC that from Monday, gatherings of 500 or more, both indoors and outdoors, should be cancelled or reconfigured. And obviously, in the words of the Commonwealth Chief Health Officer, it's from Monday because it's not a matter of immediacy, but it's a matter of getting ahead of the curve. I could also say that I understand that decisions have been made or are in the process of being made around the Crab Fest and basketball on the weekend, and we support the decisions that have been made by those organisers and I wish them all the very best for those events. Look, there is obviously some important developments globally with regards to the coronavirus outbreak. There are some very important issues, and as you would appreciate, there's a lot of global pressure in relation to all the equipment and other items that are part of this process. Yesterday, there was a sudden interruption to the availability of reagent, that is the chemicals which are used in the testing process. That has now led to a national shortage of reagent, and indeed I suspect that is a global incident, and we are all coping with the shortages associated with that. As part of that, and as well as our response in terms of the COVID-19 clinics, what we'll be doing is initiating a new regime in terms of the taking of tests in relation to the COVID-19 virus, making sure that they are more stringent, making sure that we are using our resources absolutely within the so that we don't waste any sort of chemicals or any PPE, to make sure that we are stretching our resources as far as possible. So I'm going to invite the Chief Health Officer, Andy Robertson, to provide some details in relation to all those matters.
Thank you, Minister. So as of this morning, we have had 14 cases. That's out of some 3,788 tests. As you can see, those are very small numbers out of a large number of negatives. As the Minister mentioned, there are some serious issues with laboratory reagents, and we are looking at that, and we are working very, very closely with our suppliers to make sure that we have reagent. What it has meant is that we will have to refocus our testing and to make sure that those testing is targeted towards those who have been travelling overseas or who have been in a very close contact with a confirmed case. We have had a lot of the people who presented. So, for example, yesterday we had 800 who presented at our COVID clinics. Of that, 400 were tested. What that means is that 400 presented who didn't meet the criteria. So we are looking at that, and it's of importance. And to that end, I'll hand to to Dr. Lawrence, who will explain the new protocols that are occurring at the COVID clinics.
Thank you. Good afternoon, everyone. So we'll be implementing a new process which will require greater centralisation and also improved evidence provided by individuals who attend the clinics to ensure that those tests are used by those who need them most. Therefore, what we'll be doing is in the metropolitan area, all testing will be required to be undertaken via a COVID clinic. For those people, you must have travelled within 14 days or have been a close contact of a positive confirmed case and have symptoms. If you have travelled, you will be required to bring evidence of that travel, either a boarding pass, a ticket, or a bag tag that has your details on it and the date of travel. If you are a contact of a confirmed case, you will need to have the name of that individual, which will be checked against our records. In the regional areas, you will still be able to attend your local hospital, health service, or the regional health clinics that are provided by a variety of providers. Those providers will be applying the same strict criteria, again to ensure that only those patients who truly need to be tested are tested at this time.